My name is Erin Wilt. This is case formulation number 2 for nursing 731. Jessie is a 27-year-old female reporting today. She's feeling off. She has fluctuating moods. Reports everything is fine one moment and then suddenly it's not. Moods are all over the place and she's not sure what triggers it. Also reports feeling empty and not real, like she's watching herself outside of her body. She does attempt to fill the emptiness with people, shopping, and also binge eating. Appetite does vary. Some days she doesn't eat until evening meal. Other days she'll eat all day just to be eating. Confirms her sleep is disrupted. She will lay awake at night wondering what she did wrong. She's not able to sleep. She does have difficulty maintaining friendships. If she texts someone, doesn't receive a response back, she'll text repetitively and then block and delete them. She does push people away before they have the opportunity to hurt her, per her report. She's also been calling off of work. She works the front desk at a local animal clinic, which she does report enjoying the animals. However, the interactions with clients seem to be problematic for her at times. If someone looks at her the wrong way, she reports she will go to the supply closet and cry. So she has been calling out. She also recounts a moment of staying with her friend for several days. She thought the friend was speaking about her in another room because she heard her speaking softly, though she was unable to confirm that that was about her. So she did avoid eating anything the friend prepared for the next several days because she felt she was messing with her. She also has complaint of headache and her stomach feeling as if it is in knots frequently, though she has been medically cleared. So my diagnosis for Jessie is going to be a primary diagnosis of borderline personality disorder, and I have co-occurring generalized anxiety disorder. Plan of care for her would be dialectical behavior therapy, DBT. This would be over a course of, typically DBT is 12 weeks to up to a year or so. 12 weeks being just identifying skills, and then the longer treatment plan is implementing and gradual exposure to triggers. So for Jessie, we would look at determining her goals and her plan of care, and then we would start in with mindfulness, observing how she's feeling in certain situations, putting that into words, being present in that moment so that she can feel it and she can identify it, and creating a diary record so that she has that and we can look at that and we can formulate a plan for her and what objectives and how she can navigate and what techniques she would need to do so, and also behavioral analysis. Tolerance techniques in those moments where she needs to focus on her reactivity. We would look at like paced breathing. We could also look at relaxation techniques or modalities that are used in practice other than just DBT. Oftentimes people are using yoga or some sort of exercise, music, tactile stimulation, scents that are calming or that are just nostalgic and have a positive associated memory. You can also look at distraction, which could be anything. Could be, getting up in the middle of something and going to read a book or loading the dishwasher or, watching something different on television. And then there is radical acceptance, which would just be the practice of saying it is what it is. That's how it's going to be. Or, in a moment where she's doubting herself, I've always been fine. It's always worked out for me. We would also move to emotional regulation, identifying her emotions, putting a name to it, determining is it justified. And then also there's the ability for her to perform an opposite reaction response. So saying, okay, in this moment, I would typically do this, but I'm going to go ahead and I'm going to respond this way. And that would help her to build a positive response. Interpersonal effectiveness, establishing her own boundaries, identifying how to maintain other people's boundaries, especially with just the rapid fire texting, and then the reactive behavior of blocking and deleting or cutting people off, communicating clearly to assist in maintaining healthy relationships. Over time, we would look at group sessions for her, as I would recommend individual. Initially, she does have trust issues, so establishing trust in myself as a provider, and then proceeding to group therapies, I think would be beneficial for her to have exposure to other patients who are experiencing similar situations, and help her to develop those relationships, and then eventually gradual exposure to what her triggers are to help her utilize the skills and the tools that she has obtained through services with the DBT.